The health services and other sectors of the public sector have to be quite courageous and demonstrate leadership in relation to changing the impact of alcohol and in changing alcohol culture. This is not an overnight solution, but if we don't start now, we will continue to be spending what we're spending, and we can't afford to do that. So this project is really about demonstrating workable, affordable responses that are about early intervention on alcohol, and it's about joining up the dots, and it's about connecting people in the cross-border area who get that.
The Strengthen Families programme is an evidence-based family skills programme offering skills to families. The programme was devised in the 1980s in America out of a research programme looking at the effects of drugs and alcohol had on vulnerable families. So over the weeks we're building up communication skills within the families, allowing the families to come together, to be able to talk to each other, to be able to express their feelings more clearly, to be able to communicate in terms of how should we speak to each other, how can we listen to each other, how can we work together as a family to solve our problems.
It's a journey for families, and we start off where you look at families coming together maybe for the first time as a family and as a family unit, and that in itself can be very challenging for them. But as we know, Strengthen Families is an evidence-based programme. It is starting to look at strengths, and I think the very word that we say that it is a strengthening programme as opposed to looking at therapy and counselling, which sometimes many of these families have already been through. So when they arrive and you hear for the first time that we're going to start looking at what your strengths are. For example, when they arrive that first night and they're sitting at the table, nobody's talking to each other, there's often a lot of anger, there's a lot of resentment, there's a lot of fear. And as we go through the programme, all of those anxieties slowly are actually just woven away. And we come at the end of the programme where you get families being normal families. You're not going to take away the problems and the issues, because reality is they're going back out into a world which is challenging. But what you're doing is you're equipping them with a whole range of skills. You're identifying that they have strengths, and they're taking that back out with them into the community.
The Strengthen Families programme is a real partnership between the statutory, voluntary and community sector, and it's been a wonderful experience for everybody that's been involved in it.
I think the Health and Social Care recognise that this programme is very much part of what their agenda is, particularly around the interagency working, because the family complex isn't just a problem for the health service, it's a problem for everybody. And if we all work together from the statutory, voluntary, community and families together, that we're working together, that actually we can address these issues in a more holistic way as opposed to in fragment as we've done in the past.
Referrals will come from anywhere, social services, from the Drugs and Alcohol Service, PSNI, family support workers. In the Northwest we have the family hubs.
We've supported families across the border region in developing resilience and communication skills, which will help them to complete their journey as stronger families. And we have also impacted on thousands of people at community level who have come into contact with our community mobilisation.
The community mobilisation programme it addressed all age groups, starting with the streetwise.
Streetwise, everybody wants to be streetwise, and then streetwise for life was that if you have this information here at this point in your life, that this is something you can carry with you through all your adult years.
And from there it went to Little Fish, Big Fish, which was a programme we ran for the children going from national school to secondary school, right through to the training for the various establishments around the training on alcohol misuse.
People would look at me sort of quizzically, well, what do you mean by mobilising? You know, what do you mean by that? So what I did, my way of explaining it really to community groups was to compare it to community development. Where community development would work under the ethos of participation, inclusion, equality and consultation with the community, mobilisation does exactly the same. The difference is community development generally focuses on a particular target group in the community that needs support and helps raise its capacity and builds that group so that it can support itself. It's very important to involve the community from a number of aspects. We know that alcohol-related harm in the community has ballooned over the last 10 or 15 years. People are very definitely, structurally being affected by it. And we wanted to ask communities what their concerns were, and then we wanted to help them think about ways of dealing with those concerns, and then help produce a programme or supports to see that it would happen. And produce their own action plan and then follow that action plan. Immediately interesting things started to happen, because within the first couple of months 3 groups in different parts of County Donegal highlighted the need for earlier intervention with younger children.
If you look at the word early intervention, it almost self-explanatory. It's about getting in there as early as possible, where clients are presented with kind of problems at a very upstream work. If we would look at the context of clinical work, it's seen as what we would call tier 1 or 2, where you're working where problems haven't maybe taken a hold of the person, but particularly around alcohol, where a person may be risky, hazardous, harmful drinking, as opposed to being dependent on the substance. So we're working very much upstream, looking at picking up it as early as possible, and then provide interventions at that early stage.
As part of the early intervention work in the Cavan area, we would do one-to-one work, and that would be the majority of the work that we would do. And the way we would support clients there would be really based on the needs that they would identify themselves. And for some people it's just maybe a place for them to come to talk, where they have issues around alcohol, and maybe they just need to gain perspective on the changes that they could and would like to make in their lives.
We take referrals from the GP because GPs are the gatekeepers to health, and they're going to pick up early warning signs quite early on people presenting hazardous, harmful drinking. So ideal opportunities to work there. So I would take referrals from GP practices. I also take referrals from health visitors, and specifically also referrals from midwives. So they're the 3 strands that we're working towards taking the referrals from.
We would also have referrals coming in from child and family services, where alcohol misuse has been identified as an issue in the home. We would have referrals coming in from family support agencies as well, or the family resource centres.
Clearly, I would have a national and all-island vision for our work. It's very important that we engage with all partners who have a role to play in addressing alcohol harms and helping to empower people to make healthy and informed choices about their alcohol consumption. This is a journey. Community mobilisation, which was a strong element of the Time for a Change project. Research shows that we cannot expect results or to change the alcohol culture overnight. It's a long journey. It'll take a number of years. We've, through Time for a Change, we've put in excellent foundations which we can build upon. Community mobilisation and things such as Strengthen Families programme, which was facilitated by the Time for a Change project. These initiatives can be replicated across the island of Ireland, and we have a sound evidence base on which to go forward.
We can't say that we did not know the impact that alcohol was having. We have the evidence in front of us, and we have to make decisions around that. And it is not just a matter for the health service, it's not just a matter for addiction services, it is a wider dialogue and series of actions and reactions and approaches that a huge range of stakeholders can be involved in.